Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Stephen. Screening for breast cancer is an important tool to help catch cancer early before it spreads. The COVID-19 pandemic has caused many women to skip or delay their routine cancer screenings for a variety of reasons, and experts are worried about a surge in cancer cases due to missed screenings. October is Breast Cancer Awareness Month, an annual campaign to increase awareness of the disease and remind people of the importance of regular screening. Here to discuss further is Mayo Clinic radiologist Dr. Katie Hunt. Dr. Hunt, thanks so much for joining us today.
Thank you for having me today.
A recent JAMA study found that there has been a decrease in cancer diagnoses during the pandemic. What do you make of this? Are people just staying home and not seeking routine care?
The JAMA study showed an approximately 50% reduction in new breast cancer diagnoses compared to before the pandemic. This is definitely a complex issue with a lot of factors at play, but it's important to note that in March and April, when the pandemic hit, many institutions suspended their screening programs and weren't offering screening mammography to patients, which is reflected in the study with such a dramatic decrease in breast cancer diagnoses. What patients need to know is that Mayo Clinic has responded admirably to the challenges this pandemic has put before us, and we are ready for you and are offering screening mammography to our patients. So if you delayed getting your screening mammogram because of the pandemic, schedule it now and come in. We're ready for you, and we have processes in place to keep our patients and staff safe.
What are some of the risks of skipping cancer screenings?
So the biggest risk of skipping cancer screening is that cancer has more time to grow and potentially progress to a more advanced stage. Screening mammography has been incredibly successful because we detect cancers when they're small and treatable, which results in better outcomes for our patients. We don't want to miss that window of opportunity. So again, if your mammogram has been delayed by the pandemic, please don't wait any longer and come in and get your mammogram done.
And can you share with us the current recommendations for breast cancer screening?
That sounds like it should be a simple question, but the recommendations honestly vary depending on where you look. So what I recommend to the patients that I see, as well as my friends and family, is in alignment with the American College of Radiology, the Society of Breast Imaging, and the American Society of Breast Surgeons. It's pretty simple. Women should start screening mammograms at the age of 40 and get them yearly. Women at a high risk of breast cancer, such as those who have a strong family history or those who have a genetic mutation that might increase the risk of developing breast cancer, may need earlier screening and/or screening with breast MRI. So they should talk to their doctors about what's the most appropriate screening test. The reality is that by not getting annual mammograms starting at the age of 40, the risk of dying of breast cancer is higher, and there's an increased likelihood that you'll need more extensive treatment for a cancer if it's found. I can talk briefly about some of the other cancer recommendations that you might see in the news. One commonly cited one is from the American Cancer Society, that recommends that women start mammograms at no later than age 45. However, they do recommend that women have the option to start at age 40 and get them yearly. They do have a shift at age 55 where they say that women can switch to mammograms every other year or continue yearly screening. Another quite controversial set of recommendations comes from the United States Preventative Services Task Force. They do not recommend yearly mammograms for women 40 to 49, but rather recommend every other year mammograms for women who are between the ages of 50 and 74. This recommendation has been criticized thoroughly by essentially every organization that is involved in breast cancer care, and so I do not recommend that women follow this. That screening regimen has been analyzed, and if women followed that regimen, we would miss up to a third of breast cancers and have up to 10,000 additional deaths per year from breast cancer. So again, what I recommend to my patients is starting at age 40 and getting yearly mammograms. That's been the regimen that we have the strongest data for, and that is shown to have the highest reduction in mortality for women.
Let's talk about screening options. Tell us
Sure.
about mammography and 3D mammography and who should have 3D mammography.
we're all probably familiar with a 2D mammogram. It's basically an x-ray that's taken of the breast. And a 3D mammogram, or also called tomosynthesis, is just a slight variation of that. What we do for a 3D mammogram is take an arc of pictures through the breast and get multiple, essentially, slices through the breast rather than just one picture, as we would with a 2D mammogram. What we see as a radiologist, I kind of compare to looking at the pages of a book rather than just the cover of a book that we would get with a 2D mammogram. Our computers are actually able to make what we call a synthesized 2D mammogram when we get a 3D set of images. So we really get the best of both worlds with that exam. Tomosynthesis or 3D mammography has been shown to reduce the need to have additional pictures taken if you have a screening mammogram. And it's also been shown to slightly increase the number of cancers that are detected on mammography. It's important to note that we need more study to determine whether those cancers are going to result in a reduction in breast cancer deaths, and that's an area of active study right now with a national trial. At Mayo Clinic, all women are offered 3D mammography. Studies have shown that there is benefit for all women and all breast densities.
Dr. Hunt, nearly half of women over age 40 have dense breasts. Could you explain what that means?
When we talk about breast density and dense breasts, that refers to how the breasts look on a mammogram. Women have different amounts of tissue and different types of tissue in their breasts. Our breasts are composed of both fat and then the tissue that is the connective tissue that holds the breast together, and then the part of the breast that makes milk when we're breastfeeding. So those parts look different on a mammogram. The fat we can see through and is black on a mammogram, whereas the other types of tissue are white and are difficult to see through. The problem comes in that cancers are also white on a mammogram and can sometimes hide in that dense breast tissue.
And so, for women who have dense breasts, why is molecular breast imaging important?
As I said, dense breast tissue can make it more challenging to see a cancer on a mammogram because the dense tissue and the cancer are both white. In addition, just having dense breast tissue in and of itself confers a slightly higher increased risk of developing breast cancer for women. So because of these issues, our team at Mayo Clinic developed a test called molecular breast imaging, which looks more at the function of the breast tissue rather than the anatomy, and it takes away that dense tissue that we see on mammography. It's important for women because we have done several large screening trials and utilized this in our practice clinically, and have found consistently that molecular breast imaging finds about 3 to 4 times more breast cancers in women who have dense breast tissue than screening mammography alone. That's why it's important. It's finding cancers that might otherwise go undetected for a long period of time because we can't see them on the mammogram.
And what's the radiation dose used in MBI? And I guess how does that compare to the dose from a mammogram?
The radiation dose for MBI is roughly equivalent to about 2 mammograms. They're very different tests, but I think that's a fair comparison to make. What's important to note is that the radiation doses for both of these tests are very low. They are at doses that are safe for screening and are below the background radiation that we get just by walking around planet Earth. So these are very safe tests to have. I also want to highlight that any risk from radiation at these extraordinary low radiation doses is purely theoretical. In contrast, we know that the risk of breast cancer is very real for women. 1 in 8 women is going to get breast cancer in her lifetime. And that issue is compounded when we have dense tissue that we can't see on the mammogram. So we need another tool to find these cancers, and molecular breast imaging is a great tool to do that.
Is MBI used instead of a mammogram?
No, so all of the studies that have been done with MBI have utilized it as a supplement or in addition to a mammogram. And There are a couple of reasons for this. So number one, mammography is really good at detecting calcifications, which you can think of as tiny little stones or little grains of sand in the breast. And sometimes that can be the earliest sign of a breast cancer. MBI isn't as good at, or does not detect calcifications. In contrast, MBI is very good at finding those lesions that might be hiding in the dense breast tissue. So they really work in concert together, and that's why we use them together.
Dr. Hunt, could you explain how MBI is done?
MBI is done by giving women a very low dose of what's called a radiotracer. It's a material that has a small amount of radioactivity that goes to very active parts of the breast and then lights up on a special camera. We give you a low dose injection. You're in a very small amount of compression. The exam itself takes about 40 minutes to have it completed. And so that's how we do MBI.
And is there anything else that you'd like to add?
Just want to emphasize again that women should go get their yearly screening mammograms. Mammography is still the only test that we have that has been shown to have a mortality reduction for women. So continue to make those appointments and come in and get your mammograms. If you find that you have dense breast tissue, I think considering a supplemental screening option like MBI is a great option. If you don't live in the area of a Mayo site, your region might have different supplemental screening options, so talk to your doctor about what options are available for you. I do want to thank you for the opportunity to talk to you about this important topic that impacts so many women. So thank you so much for your time today.
Our thanks to Mayo Clinic radiologist Dr. Katie Hunt for being with us today on Mayo Clinic Q&A.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.